Thank you for that introduction. And like you probably saw, I'm bringing the community perspective to this discussion. I thought I'd need my glasses, but it looks like I don't. I'm just building on what the two previous speakers have spoken about and looking at the reality of the people in the community that we see. So we run a workshop, again, looking at the reasons why we are seeing loads of migrants coming in and people on limited visas coming in and falling through the loopholes, like some of the discussions that have been put forward. And we designed a workshop where we're looking at enhancing the capacity of people on these kind of limited visas or seeking migration in terms of how they access healthcare, understanding what barriers, and really speaking to them themselves and seeing how we can support them. We also hoped that we could increase their knowledge gaps, especially around, for those who are coming to work, their rights to work in the UK, because that also hindered a lot of their access to healthcare services. And lastly, increasing their knowledge around sexual health and contraception. We ran 6 sessions, 6 sessions over 3 weeks. 2 sessions a week that were duplicated on a Thursday and a Saturday. Because some people were working shift hours, we tried to make it as flexible as possible. So somebody could attend a session on a Thursday this week and then attend the next session on a Saturday instead of the next Thursday. We made it as flexible. Content was the same so that we could get as maximum engagement as possible. We recruited through WhatsApp, through word of mouth, really get there. There are WhatsApp groups for people who come on limited visas, who are on seeking asylum. There are all these informal groups, and we were able to infiltrate some of those informal groups and, advertise the program we're doing and what they would benefit from it, and really make it clear that it had nothing to do with the Home Office. It had nothing to do with any local authority. It was a charity just trying to help the community. And this is a bit of background, which I think, again, the first speaker spoke about in terms of the diagnosis we're seeing in HIV, the increase in diagnosis from 2021 to 22, a 22% increase. And what is, I think, most concerning is that half of the people who were newly diagnosed from abroad, so 36% were diagnosed from abroad, but half of those were identifying as have been born or acquired their HIV in Africa. What this data did not really spell out was whether these people then stayed and engaged in healthcare settings on treatment, and maybe what were the barriers for them not to engage in treatment. And these are some of the things that we wanted to address by working with the community and delivering these workshops. We co-delivered these workshops with Public Health England, and they partly facilitated these workshops. So the first session of one of 3 was looking at an overview about how to access the healthcare system. The previous speaker spoke, a lot of people coming here not knowing where to go, how to access, what is free, what is not free, and that's what shaped this module in terms of what is primary care, what is secondary care, where is dentist, where does that fall, what is free, what's not free. It's simple things like contraception and knowing that you can actually get contraception from your GP. Most of the people coming from outside of the UK, that's not the system of accessing contraception. You just go to a pharmacy and you buy it. You choose what you want. There's no conversation with a doctor. So understanding those processes as you come here were things we learned to discuss. And then coming out of that, what they brought out as the challenges, there's a lot of rumors or word of mouth in terms of accessing GP services, how difficult it is. There was a lack of not registering with a GP because, again, they did not know. When they went to a GP, they were asked so many questions, and yet we know that they can freely access a GP, but because they were asked so many questions, that deterred them. Others thought they had to do it online, and when they did it online, they thought, I just take the first GP that comes. So in one situation, she got a GP 40 miles away, and then she didn't turn up, and then her appointment was, she was struck off, and then she got scared. Have I committed a crime? So there's all of that nervousness around trying to access services, and this particular person had come to work, so she's trying to get into work, get into the system. She can't get a GP, and all of that causes a lot of stress. And then a lot of people avoiding A&E, even though it was free, because again they think it might link them to the Home Office. There might be a cost attached to it, and things like that. So what came out of that is like I've said, difficulty in booking appointments. And this is the scenario I gave of the lady that was struck off because she didn't attend, but that's because she booked a GP surgery 40 miles away and didn't realize how far it was. There's a lack of financial awareness around what support is free, that there is actually support for prescriptions if you need that. There was lack of knowledge around who to share your HIV status with and who not to share. So one lady shared how she had an injury. She fell. She came here to work in the health and social care sector, fell while at work, sprained her knee or some damage to her ankle, now was being assisted by her sister to the GP, and while they were dressing the ankle, the GP then, the nurse then says, discloses her status in front of her sister, and she said, didn't give me chance to, does your sister know? So there's all those kind of issues that people face, and disclosing someone's status in a family, it's traumatic both for the person living with HIV and the family members. There was a lot of confusion around dentistry and the waiting list, and we all know that these issues exist, but not knowing what is covered by the NHS. In the second session, we covered work, and this was most attended. We were running these for 2 hours. This session went to 3 hours. We had a lawyer who came in and talked about the right to work and contracts and being able to switch a sponsor if you've come on a sponsored visa, because a lot of people were really being mistreated in their places of work but did not know that they could switch a sponsor. And a lot of people mentioned they'd never even signed a contract, or if they did, they don't have a copy, they don't know what their rights are, they don't know how to navigate booking appointments for their healthcare and taking time off work. They didn't know they had a right to do that. Not knowing whether to disclose that they were taking antiretrovirals when a nurse asked them, are you on any medication? Or when occupational health asked those kind of questions, and what kind of support that was there for them from the work environment. And a lot of the people were overworked and underpaid. Some people are working 17 hours a day. Some people are working both a night and a day shift, and therefore trying to get access their medication is difficult. And the last session was around HIV and sexual health services, and we looked at HIV prevention, we looked at testing, we looked at treatment and access to treatment and how it is free, and the rights, and also around the discrimination and what's covered around that. And there was a lot of lack of knowledge around how do they change medication, or if they, for example, had started their medication before they came to this country, how can they change? We had 2 or 3 who did not access the sexual health services because they did not know would they have to pay for their medication. They left the other medication behind. They feared to travel with it because they thought customs may be able to see it and they'll have to disclose. And those kind of practical problems. There was lack of, again, issue around sharing status and confidentiality came up, around accessing sexual health services, and the stigma related to that as well came up. What was also interesting was there was an an interest in online testing or online services, whether it was acquiring a testing kit or doing their HIV testing and STI testing at home. And there was also a great interest in PrEP around prevention. So just to show you, this is how what we got in terms of feedback, the increased knowledge, and in terms of and overall in terms of the challenges, and this mirrors the speaker one and speaker two previously around the complexities of accessing GP services, the lack of knowledge around rights, contract, the Disability Act, risky behavior, desperation, led people to live underground. So some people came here on work visas. They've been sponsored. They come, they don't find they have work. They're made to share a house, about 17, 20 people in a house. They're made to exchange sex for a roof over their head, for food, for data or on a phone. They've probably borrowed money to come here. So all that led to underground existence. Then there's the lack of awareness around financial support for certain things like prescription and navigating sharing of the status with employers. There was also lack of knowledge around access to sexual health and contraceptive services, avoiding services because they think they are not free. Confidentiality and disclosure of status really was one common theme. But what is most important is that all of these things, the socioeconomic factors, really affect their access to healthcare. Coming back to the previous speaker, if someone has housing issues, they're in a room sharing a room with another occupant, they're afraid that their medication will be seen. Therefore, they don't take the medication, and they say, we had a case and she said, but I'm fine. I don't see why I'm taking the medication. I don't want to risk being vacated from my room because I'm fine. And trying to understand that you might explain to her that you might be fine now, but in the long term, there are more complications that are going to come out. She said, my immediate need is find me a house. And you have to understand what the immediate need is if we're looking at the long term of a patient. In conclusion, we need some streamlined guidance for those on limited and restricted visas and migrants, especially some transparency with recruitment agencies around and employment agencies, and probably legalizing some of these processes as well. And then unless all of these prioritize sexual health and things we will never be addressed. So we looked at things around finances, housing, the political or hostile environment around migrants and people on limited visas. And until we can address this, health will not be prioritized. Thank you very much.